Hi, this video will show you the new Praktika's recall system. It will consist of three parts, and we shall start with part one, setting patient's recall. To start managing recalls, we must first set the recall date for a patient. It can be done in a variety of ways. Well, the simplest way is to set the recall date manually. For that, we need access to the patient's file. We can access the patient file through an appointment with the patient, or we can go to the patient directory and set it from there. So I'll do it now from the patient directory. For that, I'll go to the patient directory and I'll find the person named Brown Felix. So type Brown, there you go, there's Brown Felix. So click on the file, and I can see now the summary, the patient file navigator, and I can see there at the top where it says recall is due in days, not set. So the recall for Mr. Brown Felix is not set. I can just go to the recall section, so click on the recall button and check it here as well. So you see the days since the last completed appointment is 537 days. So, more than a year. There is no next appointment date, and the recall is not set. In this section, I can set the number of days for, when the recall is due. So in other words, I want to set the date when I should try and make a contact with this particular person. I can set it up immediately. I can make it basically right now. I may say like, look, start the recall today, and have it being placed in the recall due page straight away. Or I can set any date, any time, or any period as I like. So there are certain presets there, and I can set the recall for this particular person to 3 months. So in 3 months, this person will appear, or this patient will appear in the recalls due list. I can write some note. I'll just write some recall note. Sorry, typing error. And say OK. So you can see now the recall due is set, and it is due in 93 days. So in 93 days, it will appear in the list called recalls due. I can reset the recall, or I can actually cancel it. So if I'm not happy with this recall, I can either reschedule it to a different date, or I can completely, utterly cancel it. So if I cancel the recall, again, we will come to a situation where the recall is not set. So I can show you that by clicking cancel. It says, do you want to delete this recall? I will say yes. And you can see again that the recall for this person is not set. So here we are, no recall. So I will just go and say 3 months again, some note, and save the recall. So now the recall is set again for this person, and as I said, it will appear in the recall list in 93 days. So this is one way of setting the recall through the patient file, recall section, click on the recall, specify the days for the recall, and click OK. We can do that in a similar sort of manner by completing an appointment. I have this appointment with Mr. Matthew Gunnison, and I'll add some treatment like cleaning scale or something like this, or let's say there's a consultation there, and let's add 114, removal of calculus first visit, and say OK. So we have two procedures, $129 altogether added to the appointment, and we shall complete the appointment. So the treatment is done, the consultation is done, the cleaning is done, we complete the appointment, say yes, we're completing it, and as you see, the recall window pops up. This popping up of the recall window is actually optional. you can change the settings in the practice setting of Praktika, where you can suppress that window from opening every time an appointment is completed. By default, it does pop up, and this is a good time to actually set the recall. So you can see the recall for this person is not set. There is no next appointment. We have just completed the appointment here, and I can set the recall for this person in 12 months. And I would just write here, book another clean and scale, something like this. And I will just say, okay. I will save the clinical note. I can cancel the clinical note, and I can close that. So we have set recalls for two patients, one through the patient file, another through completing an appointment with a particular patient. Let's have a look now at the recall options settings in the practice configuration. For that, I will go to the Management module and go to the Practice Details. Practice Details, I'll click on the Recalls options. And there's a screen which controls how the recalls operate. First of all, you can see there is a default SMS template, which is used when you send recall SMSs to the patients from the Recalls Management module. This is the default recall period, which is the one which that appears in the recall screen, in the pop-up recall screen. And for this particular practice, it's set to 6 months. So basically, this is the first setting which will come when the recall window pops up. This checkbox saying complete the due recall on appointment completion means that every time an appointment with the patient is completed, the recall is reset. So the system considers that the recall was successful since we have completed an appointment, and it starts a new recall from the date of the completed appointment. If you do not have it ticked on, it doesn't reset the recall if the appointment is completed. So you complete the appointment. If there was a recall, it will still go on unchanged as it was planned. In other words, if you have a recall due in 3 days, for example, and a patient comes in today for whatever reason, emergency or something, and you complete the appointment, and the recall, which is due in 3 days, will not be reset. So in 3 days' time, you would need to contact the patient, send a letter or something, whatever you planned to do for the recall, and then the recall will just go as normal. If you have it ticked on when the patient comes in and you complete the appointment, any future recalls are considered to be already done and successful, and they'll be reset from the date when the appointment is completed. This part of the screen says when to show the patient recall screen upon the appointment completion. And there are a few conditions which you may enable or disable. So, for example, if the appointment contains a certain set of procedures, these are being consultations and clean and scale, only then the appointment will, only then the recall screen will pop up, and it will not pop up in other instances. If the treatment plan is empty, so if there is no treatment plan or there are no proposed treatment procedures for this patient, it will then pop up, or will not if you untick it. If patient has no recall set, in other words, if the patient has a recall already, it will not pop up. If patient has no recall, it will. If the patient has no appointment in the future, similar situation. If the patient has an appointment in the future, you do not want to reset the recall, you do not want this screen to pop up. Or you may want to. So it's up to you. These are all optional settings which you may enable and disable. You may combine them in a different way and get the result that you want. Because people do manage recalls differently. Some people do want to reset recalls. Some people do not want to reset recalls. So, the optional settings here give you all those possibilities of configuring your workflow properly. The last setting here is the number of days after which a recall action is prompted. We will come to that later in the following section, or I would say probably in section 3, where we are going to manage the recall groups, and you will see where this number will actually show, and why it is important to set it to the number of days which would be proper for your particular workflow and your own practice settings.